Cholera outbreaks are surging across West and Central Africa, with children once again bearing the brunt. UNICEF warns that an estimated 80,000 children are at high risk as heavy rains, flooding, and poor sanitation fuel the spread. The Democratic Republic of Congo and Nigeria are among the worst hit, with several neighboring countries also on high alert. Joining us on the line now is Claude Ngabu, a health specialist with UNICEF working in the region. Good evening, Claude.
Good evening. How are you?
All is well, thank you. Claude, how serious is the current cholera situation across West and Central Africa?
Yeah, thanks very much for the opportunity. Just to let you know that the situation is at extremely high risk. The disease is spreading in a number of countries. And as you said, more than 80,000 of children are estimated to be at high risk of cholera in West and Central Africa region. As you said, the Democratic Republic of Congo is the most affected, followed by Nigeria, and there are several other countries that are also facing active epidemics, which include Chad, the Republic of Congo, Ghana, Cote d'Ivoire, and Togo, while others, such as Niger, Liberia, Benin, Central Africa Republic, and Cameroon, are at close surveillance. So it's very important to mention that it's extremely at high risk, the disease in the region.
UNICEF estimates that 80,000 children are at high risk. What's making children so vulnerable in this outbreak?
Very important. Children face a high risk and are particularly vulnerable due to several interconnected factors such as poor hygiene, inadequate sanitation, and access to safe water. And, smaller children have a high risk of dehydration. Then they can dehydrate much faster than adults, giving families and healthcare workers less time to intervene effectively. So it's very important to mention finally that young children are particularly vulnerable due to the weakness of their immune system, leading to increased morbidity and death.
The DRC has reported over 38,000 cases. What's the situation on the ground, especially in Kinshasa?
Yeah, the situation is very hard and it's big risk, especially in Kinshasa. The country has facing flooding and heavy rains during the last month, which affected water and sanitation system. The country is, experiencing mass floods over the past weeks. Many provinces have been affected with the heavy rainfalls, leaving to a million people living in need of assistance. There are intense floods, especially in Chassa, which have worsened the outbreak.
What are the key factors driving the outbreaks? Is it mostly flooding, poor sanitation, or something else, Claude?
Yes, those are some of the main reasons, but we can also highlight the fact that conflict combined with population displacement, can leave people without access to clean water and basic sanitation, and the health system, the impact on the health system, which have been overwhelmed with the healthcare gaps, delaying response times, and sometimes limited access to treatment in some specific area like rural areas. I talked about lack of access of clean water. It's important to highlight here that there are some underlying causes like malnutrition, especially among children under 5, increasing their vulnerability, as I was saying earlier, leading to increased death. Here, we'll close by saying that we cannot forget the impact of the climate change playing a key role in already fragile contexts, which leading to intensity of rainfalls and floodings.
Nigeria is also severely affected. Why do outbreaks keep recurring there?
Yeah, and cholera is known as endemic in Nigeria. It's spreading in many provinces and many states. Those some of those reasons I have stated for DRC do also apply to Nigeria. And beside that, it's important that especially in the north there is an issue with access to healthcare and population movement, which has increased in the last days the risk of cholera in Nigeria.
Mm. Now, what's the situation in Chad's refugee camps, and how is displacement making things worse?
Yeah, very important. In Chad, there have been some cases notified in the refugee camp. There are several camps in the East Chad, especially in Wadifira region. This is something which need to be taken into account here. The fact that those are refugees in camps, in some crowd camps, with the lack of hygiene and poor access to sanitation. Those factors have led to cholera outbreak in Chad. We cannot forget the situation in Sudan, which is has some the border with the east part of Chad.
Are there signs of cross border transmission between countries in the regions?
Yes, absolutely. There are some cross-border issues, and in our region we have some poor borders where people do travel from a country to another. This is very very important to know that there are some cases notified in Togo, Ghana, which are closed to Nigeria. We cannot link those cases directly to the case in Nigeria, but there are some risk factors. I would like here especially highlight the case of Republic of Congo, which is very close to DRC, especially in Kinshasa. The Congo River is at the border with the Republic of Congo and the Democratic Republic of Congo sharing the border. And as the disease is spreading along the Congo River, there were some cross-border, suspect cross-border transmission between countries. Lastly, I would like to say, and especially the case of Angola, which is close to both DRC and the Republic of Congo, increasing the risk of cross-border transmission.
Mm. How now? How is UNICEF responding? Can you talk about the focus areas like clean water, healthcare, and vaccines?
UNICEF is working with government and in affected countries to ensure that the response is fully aligned with the national priorities and the country response plans. It's important to notice here that UNICEF is working on a multi-sectoral approach for the response, focus on some pillars. Some of them are water, hygiene, and sanitation, as we have already explained earlier. UNICEF is working on increasing access to clean water in affected areas, providing drinking water, water treatment kits, supporting sanitation infrastructures, distribution of safe water, provision of sanitation supplies, and good to notice that UNICEF is also working on the treatment, on the treatment of cholera cases, in supporting the establishment of cholera treatment centers, let's say cholera treatment units in some places with essential medical supplies like oral irritation, IV fluids, and antibiotics. In some cases, in some places, UNICEF do support deployment of medical staff and training of frontline workers in cholera case management. Our focus is also on the risk of communication and community engagement to make sure that the communities are fully aware of the disease and do adopt some measures, hygiene measures, and promotion behaviors in line with cholera. One component is vaccination support. UNICEF is working for the provision of oral vaccines through its supply division, and is supporting cholera vaccination campaigns with the rollout especially in high-risk zones. There are some interventions, including nutrition support. I was talking about the fact that it's important in some high malnutrition areas to ensure that there is a combined screening of and treatment of malnutrition to ensure that those interventions are fully included in cholera response efforts. Finally, UNICEF is working to ensure that the coordination mechanism, because this is one of the most important part of the response, it needs to be through a coordination mechanism, a coordination system, mainly under the Emergency Operations Center, National Emergency Operations Center, to ensure that data are collected, analyzed, and there is a rapid deployment of response team. There is attached to that the risk assessment of disease, where UNICEF can and do play a key role.
So you're appealing for 20 million US dollars. What would that funding help you deliver over the next few months?
UNICEF is appealing for $20 million to ensure that to ensure a rapid scale up of cholera response efforts, where I've already explained what UNICEF is doing on the field, but it needs to be rapidly increased and scale up, focusing on the most vulnerable population, especially children in affected countries. These interventions are fully oriented on areas like health, water, hygiene and sanitation, risk communication, and community engagement to ensure that UNICEF is, targeting the high risk and most vulnerable population.
Now, what makes you believe that this outbreak can be contained, and what role can communities play?
Yeah, this outbreak can be contained. It's important to have some immediate priorities, immediate actions, while there is some long-term, mid-term, and long-term interventions. It's here important for a country, high country collaboration, increased collaboration between countries through cross-border collaboration. We already talked about the cross-border aspect. There is a need of strong collaboration between countries, sharing data and resources, increase the surveillance system, the early warning and the early action mechanism to detect and respond to new outbreaks. There is an action, a specific action, which is oriented to identifying the high-risk zones, the high-risk areas where it's important to intensify monitoring and reporting system, while working on other aspects. We talked about access to water and sanitation. We talked about distribution of kits. We talked about healthcare and treatment, ensure that health centers are fully operational. We talked about some prevention measures. This is one of the most important things to say here. Very important to increase prevention, the preparedness, the community engagement, the community awareness attached to the rollout of cholera vaccines to ensure the outbreak is contained.
Claude, thanks for joining us this evening to talk about this.
Thank you very much.
That was Claude Ngabu, a health specialist with UNICEF, speaking to us about the urgent cholera crisis unfolding across West and Central Africa.